I think I underestimated how much the sheer size of the House of Representatives affect how you have to operate within the House. 435 people is a lot of people, and it's a very fragmented, disjointed process, very different from the Kansas system, that requires much more time and effort to build relationships. This is a relationship business. Even with people you're working with that you disagree with strongly, you have to be able to work with them. To do that, you have to know them, and that has taken more time than I had anticipated, simply because of the size. And I think that's an area in a second term I can continue to be more effective. You can't just start at zero and do that. And so I think we'll have some advantages for the district that I've invested that time and effort over the first. I would also say, in a more general sense, DC is a much noisier environment in which public policy gets debated and decided one way or the other than Kansas is. I'm a Midwestern guy who likes to get along with folks, happy to fight when it's necessary, but I prefer to work cooperatively whenever we can. And there have just been fewer opportunities for that in Washington. The parties are pretty entrenched. I've actually worked with a number of Democrat House members on different policies. Some we've gotten enacted, others we're still working on. We haven't, it's not a secret, but we haven't made it a big high-profile thing because we think we're more effective when we just go do it. So I'll give you a real example. I represent Fort Riley, and Geary County. Irwin Army Community Hospital on post is a tremendously important military asset. There have been discussion over recent years before I got into office about having it on a list for potentially degrading to a clinic, as there have been at other posts. That would be unacceptable for Fort Riley because it is a heavy combat division. You cannot have large numbers of people doing active military training where people sometimes get hurt and not have a full service hospital right on post, especially when they're not close to any major city. Topeka is the closest. So we have to maintain a full service hospital on post at Fort Riley. We need to end this conversation about potentially downgrading. So I engaged with a lot of players. We were involved with Senator Moran, Senator Marshall, others. But I particularly engaged one of my new colleagues from Maryland, Democrat member. She represents Walter Reed, and they have a similar issue, obviously not a combat operation, but they have a similar dynamic of trying to make sure they maintain services. We were able to come together, come up with some new authority for the Veterans Administration to work closely with the Defense Health Agency to provide the opportunity to treat more veterans on military posts, like at Fort Riley, like at Walter Reed. And the idea was to make those posts more sustainable, more effective, more efficient, be able to draw in more talent, a wider range of services. Everybody wins. And we got it done. It was enacted into law as part of the Defense Authorization Act this year. So it's a good example of being able to work in a bipartisan way, but not in part of the loud and noisy debate that is Washington these days.